Christmas, and the same will continue into 2026 with a healthy and a peaceful 2026 for you all. Right, guys, if at all possible, avoid attending accident and emergency rooms. Figures just released that should have been broadcast to the people of Ireland over the past 12 months, for some reason or other, were never exposed until now. At least 48 people a week are estimated to have died unnecessarily in 2025 due to emergency department weights analysis by a leading data scientist and A&E expert reveals. Health Minister Jennifer Carroll McNeil says our hospitals are dealing better with overcrowding and that the number of patients left on trolleys has declined. But folks, that's bullshit, and you will find that out as I keep going through this video. However, an analysis carried out by a man called Dr. Stephen Black, who co-authored an extensive British medical journal study on the impact of long A&E accident and emergency, which shows between 2,500 and 5,000 people are estimated to have died over the past 12 months due to prolonged waits at emergency departments. According to the analysis, a minimum of 48 and as many as 96 people could have died unnecessarily every week during the past year due to overcrowding and A&Es. The findings echo a similar study carried out by the doctor last year. Commenting on the figures, Irish Patients Association founder and director told a weekend newspaper journalist, if these numbers were road deaths, we'd call it a national emergency. But in healthcare, we've learned to describe the pressure. The estimate of 2,500 to 5,000 excess deaths reflects the application of peer-reviewed evidence to Irish emergency care activity. The underlying evidence comes from a major study published in the Emergency Medicine Journal, co-authored by the doctor, which found delays in inpatient ward admission beyond around 5 hours are associated with increased all-cause 30-day mortality, with risk rising as delays lengthen. So folks, for your own good, if you can avoid A&E, for your own benefit, do so, especially senior citizens. The study identified a clear dose-response relationship and reported that statistically, for every 82 admitted patients delayed between 6 and 8 hours before transfer to a ward, there is one additional death. The new data emerged as hospital staff across the country are braced for the annual winter surge that usually hits in the early weeks of January. Overcrowding levels are also likely to be exacerbated by a more virulent form of flu that is currently in circulation. But folks, an awful lot of this flu, you can put down equals after it, is chronic care capitalism. But Irish media won't dare tell you that. Data scientist Dr. Black from Belfast calculated the number of unnecessary deaths at hospitals by analysing waiting time figures compiled by the HSE and trolley numbers recorded by the Irish Nurses and Midwives Organisation. Detailed breakdowns of waiting times are readily available in the UK, but in their daily reports about A&Es, the HSE only provides figures for patients forced to wait 24 hours or more. So why is the HSE not releasing the full statistics? This means the HSE figures only provide a partial insight, as it is generally accepted adverse health outcomes are linked to A&E waits of 5 hours or more. For his analysis, the doctor cross-referenced the limited HSE data with the INMO, with the Irish Nurses and Midwives Organisation figures. He also studied more substantial figures released by the HSE in 2024, when the average A&E waiting time was generally around 12 hours. So lads and lassies, what Jennifer McNeil, the Minister for Health, current Minister for Health, is telling us is BS in capital letters. Despite the limited data available, Dr. Black was able to estimate that at least 2,500 people died as a result of overcrowding in hospitals this past year. He also said the thing most clear from the data is that they can see the people waiting more than 24 hours. It looks like trolley numbers as compiled by the Irish Nurses and Midwives Organisation are better towards the end of 2025 than at the start. There are fewer trolley waits. That's probably a good sign. The data analysis said the HSE should be much more open about hospital A&E waiting times. But who's open about anything, folks? In any of these government departments? Not too many, if any. He doesn't want to say they are not releasing the data and that it's a cover-up that would be unwarranted. But if they really wanted the people to trust that there have been improvements, they would show us more data. Of course they would, folks. So when they're not releasing it in full, they are obviously hiding stuff. Every week or every month, you would want to know how many people are waiting more than 4 hours, how many are waiting more than 12 hours, and how many are waiting more than 24 hours. You know yourself if you go to a A&E, guys, especially on the weekends. You could be there for the long haul. You'd want to bring a packed lunch with you, if you were able to eat it. Some of that is clearly not there, or it is really hard to find. If it was there, people would be able to look and double check whether the government is correct in saying that things are getting better. But folks, delivering this video to you are hearing numbers, but like always, the government of Ireland always covered up stuff. Media and Gardaí protect them and cover them up the whole time, cover up for them the whole time. So who suffers as a result? The population that they are all authorities are alleged to be governing. In response to queries, a spokesperson for Minister Carol McNeil's department insisted improvements have been made in emergency departments, with trolley numbers down 9% year on year, even though there was a 4% increase in people presenting at A&Es. It's a bit ridiculous, guys. They added, even though there had been an 8% rise in the number of older people going to emergency departments fewer people aged 75 and older had waiting times of 24 hours or more. Well, if a senior citizen goes in, folks, to A&E, they should be prioritised. They have earned it throughout their lives by working and contributing to the state funds all their lives. However, the HSE did not respond to queries or explain why it was unable to provide a detailed breakdown of waiting times made available in recent years. Another individual said that while ministers may point to improvements in headline figures, from a patient safety perspective, the system is running hot and very hot. The patient advocate also added, snapshot trolley numbers do not capture the risk carried by prolonged delays once a patient is already sick enough to need a bed. Fewer headline incidents do not mean the danger has passed. So fewer headline incidents do not mean the danger has passed. So guys, if at all possible, avoid accident and emergency rooms for your own benefit. If a senior citizen has to go, accompanying them, because God only knows what is capable of happening. Okay guys, if I don't talk to you before the new year, have a good one. Healthy, happy and prosperous new year 2026. Alright guys, good talking to you.